If you've spent the last few years carefully avoiding salt, reading every label, skipping the bread basket, asking the waiter to leave the salt shaker in the kitchen I need you to hear something that might be uncomfortable. For a lot of people over 60, that strict total salt avoidance isn't lowering blood pressure the way you think it is. Here's the thing most people never get told. Blood pressure, especially that stubborn morning spike, isn't only about how much sodium goes in. It's about a handful of factors working together. And salt restriction, taken to an extreme, can sometimes throw one of those factors out of balance. Today, I want to walk you through what's actually happening, why total salt avoidance isn't the full answer for most seniors. The specific 10-minute thing my patients do instead that tends to move the needle more reliably than another year of bland food. And a few of the most common questions I get asked about all of this at the counter every week. Let's start with what almost nobody explains clearly. When you cut sodium aggressively, Togue, and I mean aggressively, not moderately, Togue, your body responds by activating something called the renin-angiotensin-aldosterone system. It's a survival mechanism built into us long before processed food and blood pressure cuffs existed. Your kidneys sense low sodium, and they release hormones that try to hold on to whatever salt is left and tighten your blood vessels in the process. In your body, this self-correcting system works smoothly, adjusting in the background without much consequence. But after 60, especially if you're also on a diuretic or a blood pressure medication, this compensatory response can become exaggerated. Research in geriatric pharmacology consistently suggests that overly aggressive sodium restriction in older adults can, in some cases, that's the part that surprises most of my patients. They assume less salt always equals lower pressure, in a straight line, no exceptions. The research doesn't support that simple a picture, especially for people over 65. It's not that salt doesn't matter, Kameem. It absolutely does. And I'm not telling you to go back to the salt shaker. What I am telling you is that obsessive avoidance on its own, without anything else, is an incomplete strategy. And for some people, it creates a kind of compensatory tightening in the vessels that shows up specifically as that morning spike. The one number that frustrates people more than any other on the chart. There's a second piece almost nobody mentions, potassium. Most seniors fixate entirely on reducing sodium and never think about increasing potassium, even though the ratio between the two is, according to multiple cardiovascular studies, more predictive of morning blood pressure than sodium intake alone. When you drastically cut salt without addressing that ratio, you're only working with half the equation. It's a little like turning down the volume on one speaker and wondering why the room still sounds unbalanced. You fixed one side, but the other side was never touched. There's a third factor too, one that's almost never discussed in the same conversation as diet: how well your blood vessels themselves can relax and expand when they need to. We call this vascular reactivity, and it has very little to do with what's on your plate. It has everything to do with your nervous system, and specifically, what happens to that nervous system in the first hour after you wake up. Let me walk you through an illustrative scenario. Let's call her Margaret, 68, a retired teacher. Margaret came to my counter every single day, the same pattern, 148/92 in the morning, settling down to something closer to normal by early afternoon. She'd cut salt from her diet almost entirely. No canned soup, no deli meat, no added salt at the table. She'd lost the satisfaction of food, she told me, and she still wasn't seeing the morning number budge. What Margaret hadn't done was anything to support her vascular system directly in those early morning hours, the window where blood, driven by cortisol and the sympathetic nervous system kicking into gear. That's the piece that was missing. And once we added it, her morning readings started shifting within about 3 weeks. Not because she suddenly ate more or less salt, but because her vessels had a tool to respond with. Let me give you a second illustrative scenario, because this isn't unique to Margaret. Let's call him Walter, 71, a retired electrician. Walter's situation was almost the opposite of Margaret's in one way. He wasn't restricting salt at all, he was eating fairly normally, but his morning numbers were even higher than hers, sometimes touching 160/95. What Walter had in common with Margaret was the missing piece. Nothing in his routine addressed that early morning surge directly. His doctor had increased his medication twice in 18 months, and the morning number barely moved each time. When we added the same breathing practice I'll walk you through in a moment, his morning ratings dropped by close to 12 points within 5 weeks. without any change to his medication or his diet. Two very different starting points, the same missing piece, and the same simple fix. Here's what I told both of them, and what I want to walk you through now. Morning blood pressure spikes are driven largely by something called sympathetic activation. Your nervous system flips into go mode as you wake, releasing cortisol and adrenaline, which constrict your blood vessels to get blood moving and get you upright. For most of us, that's a brief, manageable surge. But for older adults, especially those whose vessels have lost some elasticity over the decades, that surge can linger. And it can layer on top of whatever baseline pressure your sodium intake is producing. The research consistently suggests that the single most reliable way to counteract that morning sympathetic surge isn't found in further dietary restriction. It's found in something called vascular conditioning, training the blood vessels themselves to dilate and relax more efficiently on demand. And the specific tool that shows up again and again in the cardiovascular literature for this purpose is a slow, structured breathing practice, done consistently, ideally in that early morning window before the surge fully peaks. So let's get into the actual 10 minutes ones, because I promised you something concrete and I want to deliver it. What I recommend to my patients isn't a generic deep breathing suggestion. It's a specific paced breathing protocol, the kind that's been studied in relation to vascular tone and morning blood pressure. Here's the structure. You sit upright, feet flat on the floor, somewhere quiet now. Your kitchen table works fine. You breathe in slowly through the nose for a count of 4. You hold for a count of 2. You exhale slowly through the mouth for a count of 6. This part matters more than people realize, because the extended exhale is what activates your parasympathetic nervous system, the rest and digest side of things that directly counters that morning sympathetic surge we just talked about. You repeat that cycle, then 4 in, 2 hold, 6 out, then for 10 minutes. Most of my patients do this right after waking, before coffee, before checking their phone, before the day's stress has a chance to layer on top of the natural morning surge. What's happening physiologically during those 10 minutes is fairly well understood. The extended exhale stimulates the vagus nerve, which signals your blood vessels to relax and dilate. Heart rate variability improves. And over weeks of consistent practice, not one session, but a daily habit, often in the range of 5 to 10 points, which for many people is the difference between an uncomfortable number and a manageable one. I want to be careful here, because I never want to overpromise. This isn't a replacement for any medication your doctor has prescribed, and it isn't a guarantee for every single person. Bodies respond differently. And there are other contributing factors like sleep quality, weight, and underlying cardiovascular conditions that play a role too. But as a tool that costs nothing, takes 10 minutes, and has real physiological backing. Now, I promised I wasn't telling you to abandon sodium awareness altogether, and I meant that. Here's the more balanced approach I walk patients through. First, instead of eliminating salt, shift your attention toward the potassium side of the ratio I mentioned earlier. Foods like potatoes with the skin on, white beans, and bananas can help your body manage sodium more efficiently than starving yourself of it entirely. Leafy greens like spinach and Swiss chard also tend to be high in potassium. And many of my patients are surprised to learn that a single baked potato with the skin can contain more potassium than a banana. Talk to your pharmacist or physician about whether increasing potassium-rich foods makes sense for you, particularly if you're on any medication that affects potassium levels per. Certain blood pressure medications and kidney conditions change this calculation, so it's not a one-size-fits-all recommendation. Second, pay attention to processed sodium specifically, the kind hidden in canned goods, deli meats, and packaged sauces, rather than treating all sodium as equal. The sodium naturally occurring in whole foods behaves differently in the body than the concentrated, isolated sodium added during processing, and fiber that change how your body handles that sodium. Most of my patients can ease up on the all-or-nothing label reading anxiety once they understand that distinction. Third, and this is the piece most people skip entirely, pair whatever sodium moderation you choose with that morning breathing practice. The two work on completely different mechanisms. One manages intake, the other manages your vessel's response pennant, and together, according to the cardiovascular literature, they tend to produce better outcomes than either approach alone. Let me answer a few of the questions I get asked most often about this. It's rarely dramatic on day one tide. This is a conditioning process, not a quick fix, and that's actually a good sign, because gradual, sustained changes tend to hold up better over time than anything that happens overnight. Can I do this practice at any time of day? You can, and there's research supporting paced breathing at multiple points in the day for general stress and blood pressure management. But if your specific frustration is that morning number, doing it in that early window crée, before the sympathetic surge fully peaks home, do I still need to take my blood pressure medication? Let's discuss this together. Always continue any medication exactly as your doctor has prescribed it, and never adjust a dose based on anything you hear in a video, including this one. This breathing practice and a more balanced approach to sodium are meant to work alongside your treatment plan, not instead of it. If your numbers start improving meaningfully, that's a conversation to have with your physician, not a decision to make on your own. What if I have a heart condition? Is this still safe for me? For the vast majority of people, slow-paced breathing is gentle and well-tolerated. But if you have a diagnosed heart or lung condition, it's worth a quick conversation with your physician before starting any new breathing practice, simply so it fits appropriately into your overall care. I think about Margaret and Walter a lot, because their stories aren't unusual in my practice. So many of my patients have spent years treating blood pressure as a single math problem. Rho, less salt in, lower number out route, when the body is actually running several systems at once. The nervous system, the vascular walls, the kidneys, the hormonal surge that happens every single morning, whether you've had salt or not. When you only pull on one lever and restriction woe and ignore the others, you can end up exactly where Margaret was, doing everything right by the old playbook. And still staring at a frustrating number every morning. Or exactly where Walter was, not restricting much at all, but still missing the one piece that would have actually moved his numbers. So if there's one thing I want you to walk away with today, it's this. The goal was never to fear salt completely. The goal is to give your blood vessels the tools to respond well to the morning surge that's coming, whether you've cut salt or not. And that tool is sitting right there in your own breath, free, available every single morning for 10 minutes before your coffee even finishes brewing.
Here's something concrete you can do today, even before you finish watching this video. Tomorrow morning, before you check your phone, before the coffee,
sit down at your kitchen table and try that breathing pattern. 4 in, 2 hold, 6 out Pharman for just 10 minutes. Track your blood pressure before and after for a week and bring that log with you to your next appointment. Talk to your pharmacist or physician about whether easing your sodium restriction in favor of a more balanced approach makes sense for your specific situation and your specific medications. You now know something most people your age don't, that the morning number on your cuff isn't only a referendum on how careful you've been with the salt shaker. It's a conversation between your nervous system and your blood vessels, happening every single morning, whether you're paying attention to it or not. And now you know how to join that conversation instead of just reacting to it. I'll see you in the next video.